Hello, everyone, and welcome to the Mystic Health webinar. Thank you for joining us on a Saturday. It's really nice to be here as we get started. My name is Dr. Houman Farzin. I'm the founder of Mystic Health. We are a holistic health practice now operating in Southern California. I have a very special guest today, Dr. Amir Vokshoor, and I have been connected through family, and we've been having amazing conversations for years and envisioning a collaboration together. It's my honor to introduce him and talk about all the exciting things that he has done and we plan to do together. Dr. Vokshoor is a board-certified neurosurgeon with over 20 years of experience and a reputation that stretches far beyond the operating room. He is the chief of surgery at Providence St. John's Health Center in Santa Monica. He's an internationally recognized leader in spinal disc replacement and motion preserving technologies. But what makes his presence here today very special is his pioneering vision of integrative and holistic neurosurgery. As the founder of Neurosurgical Spine Group, the Neurovella Brain Spa, and the Institute of Neuroinnovation Research, he's developed programs that merge the precision of modern neurosurgery with the healing power of mindfulness, non-invasive therapies, and brain-body connection. His work is at the frontier where science, soul, and service intersect. And I can say personally that every time we've spoken, I've walked away inspired, grounded, and having a sense of deep appreciation for what we can accomplish together in a multidisciplinary, advanced way. Dr. Vokshoor, thank you for joining us. I would love it if you can also introduce yourself and tell us a little bit about what you do and what brings you to us.
Thank you so much, Dr. Houman. Thank you for the very kind introduction. It's an honor to be here and start this series of hopefully many conversations about collaboration in multidisciplinary approaches and applied neuroscience to what we do on a daily basis as clinicians. So I've been a neurosurgeon for over 20 years, as you said, and my main job is actually microscopic spine surgery. So very minimally invasive techniques to do spinal surgery. And I always wanted to be sort of more accurate about our success rates and outcome. And I wanted to be accurate in a way of even meeting patient expectations, not just be accurate about, say, the results on the X-ray or the MRI, which is, the result of very precise surgery, anatomical correction, but also be accurate about how a patient will feel their satisfaction level and their ability to really resume a lifestyle that they set as their goals over the ensuing months post-surgery. And that was what led to where we are now, which is unless you treat the nervous system on the multitude of fronts that it deserves and it actually brings to us, both the psychology and physiology and anatomy of the spine are interrelated with brain health. And that's what brought me to where we are now.
Amazing. Um, I know that you have a very holistic vision when it comes to patient care, and I really appreciate that. You're very patient-centered. You're very honest, and the care you want to give is exactly that. It's not about pushing people to a certain procedure, but what is the best outcome we can achieve. And I know for this, you've developed certain programs and approaches, especially in the Neurovella Brain Spa. I wonder if you can talk about Neurovella, what inspired you to do, what has it done, and what the outlook is.
Yes, thank you for that. So Brain Spa is a culmination of what we call applied neuroscience in a clinical setting. So we've known that certain holistic practices, like even the things as simple as breath work, change physiology. And I was employing that early in my career as a way of trying to treat people's postoperative pain. So instead of, for example, taking more opiates, can we use ice and deep breathing to get over some of the painful episodes? And certainly, psychedelics come into part of this conversation as well. So I came up with this concept of having a brain spa where we actually have a laboratory of a person's nervous system where they engage with their mind-brain connection and employ therapeutic approaches, including meditation, including breath work, including some of the things that you're involved in, which is psychedelic assisted therapy. That would be the at the more intense level of what we would be offering at the brain spa. But on a very primitive, I would say entry level, is teach people how to breathe well. And the surgical trauma is a great sort of index event that in my practice, again, in trying to be more accurate with our success rates, this is all about precision. I want to be able to tell a patient how they will feel 6 weeks, 6 months, 12 months after a surgical event. So the surgical trauma is sort of this index event around which we have a lot of great neuroscientific approaches that we can do to optimize someone's care. And many people, they have incredible psychological balance and they may not need the psychological therapies of Neurovella, but on the physical front, pain management techniques, and we'll go into the sort of what we call the four horsemen of the nervous system later, and that's where I&I comes in. But pain management techniques and other sort of physiologic entry level techniques such as meditation, which is a charged word, and I understand we can delve into that a little later. I was always curious whether we can employ those techniques in optimizing and improving patient outcome around spinal surgery.
Amazing. Yeah, I think this it's a revolutionary way to look at it, because the role of our state of mind, as a patient going and having this procedure, a lot of times a singular reductionistic reductionistic approach doesn't solve a complex problem, and I think
I'm
um,
really happy you mentioned that. Even as simple as just decreasing anxiety around around a surgical event. I mean, many of my patients are just simply scared of having spinal surgery because traditionally, who wants to have back surgery? Who wants to have neck surgery? It's not like heart surgery where the outcomes are, really nicely set. It's a little all over the place. So this Neurovella and I are our attempts in getting more accurate, more precise surgical outcome and optimization.
amazing. And I know you've been working on this concept of the octaves. I wonder if you can tell us a little bit about these octaves.
Thank you for mentioning that. So I always knew, and this is something I'd love to talk to you about more because you know about the oscillations of human physiology very well, and I think even in psychedelic states, this really comes to play. I got interested in the fact that the nervous system has to oscillate between deep focus, which means task-oriented approach to getting something done, like me in surgery, and recovery or deep detachment, which in a great example of it is deep sleep. And so I got really interested in the fact that my patients should be either engaging in a training for task-oriented recovery or recovery in detaching and going to the empty space that the Buddhists have mastered. So I got really interested in this concept and I started reading and got really interested in neuroscientific principles of the free energy principle by Friston and Carhart Harris's entropic brain model came into play. And so I do believe that brain health is a very, very important part of any sense of health that we have. So we started talking about states of consciousness that employ these principles in a oscillating manner, and that's where the octaves are born. My initial I'd say rendering or curation of these states was consciousness almost as orbitals. And the more detached you get, you're in a higher orbital of consciousness. That's been revised a little bit based on the free energy principle and the entropic theory of brain function, is that you constantly do want to have both ends because uh, our optimal brain function is actually very close to riding a bicycle. You do want a certain level of order to create memory, to have task-oriented learning, and I mean, this is a learning experience for me right now as we're interacting together. And then you also want to have this recovery or detachment that happens in psychedelic states, in lucid dreaming, in REM sleep. Um, and Anesthesia was really interesting to me. So, we do a lot of neuromonitoring during anesthesia for spine surgery. And that's where I got into some of the other theoretical works of Stuart Hameroff and Dr. Penrose that talk about this concept of orchestrated objective reality. And not to get too physicky about it or go into esoteric concepts, but there are states of oscillation in brain based on the amount of order and disorder that can be utilized to create different orbital levels of consciousness and conscious access. And so, this concept that consciousness exists at a very primitive level beneath it all, when you're just waking up or something, when you're not even sure where you are, or in certain dream states, that's when you have access to this kind of primary consciousness, which we try to create in what we call the room zero of Neurovella. And in room one, we have all the task-oriented cognitive control things that make you do what you want to achieve better. And think of a fighter pilot, a neurosurgeon, a tennis player, any kind of like sports-related training or task-oriented training goes into that. And one of the coolest, I would say, terms to describe that is by Dr. Csikszentmihalyi. So describe a flow state. The flow state is when you are doing something task oriented, but you're almost in this dream state of doing your task. And I think we could get really specific about things that become cerebellar as opposed to cerebral, and that's how we look at structural anatomy of the nervous system together and their interrelatedness. So sorry to be so wordy, but the orbitals, the octaves of consciousness, is what the ultimate offerings at Neurovella will deploy to enter these states of oscillation between complete detachment during recovery and task-oriented training.
Thank you. Yeah, I think everything you said is very spot on. I'm very fortunate to be part of the McGill faculty teaching mindful medical practice. It's a mandatory course now for second year medical students. And the idea is that this mindfulness, this ability to be present, and in order to function better as a physician, just self-awareness, awareness of the other, of the context, like preserving the humanity, doing our tasks in a mindful way such that we don't have unnecessary distractions. That is kind of, that flow state that we
Indeed.
talk about. And what you mentioned in terms of the primary consciousness, sort of that a more subconscious, authentic experience of awareness that usually lies underneath our normal state. That's what we try to tap into with psychedelic therapy. And the word psychedelic means mind manifesting. It's that idea that we can tap into the things that we don't normally have access to. And the last thing that came up for me was in trauma treatment. We have this concept of resourcing and processing. And that's sort of, it's a similar thing. In order to process heavy content, you have to be resourced. So you can't just do the task. You have to be able to sort of disconnect, go to a more resting, resourcing state, and then go back to your task. So it
I
sort
love
of
that.
mirrors what you said.
That very much is what I said. It's like creating potential in your nervous system so you have the energy to actually tackle the problem at hand.
Yeah. I think it's a good opportunity to talk about the four horsemen, as you always say.
Yes, indeed, and they're certainly not distinct entities, but humanity is facing an epidemic I would say epidemic proportion of neurologic disorders, and the Four Horsemen, which is Peter Attia coined that term, so I want to give him credit for that. But in the nervous system, our Four Horsemen are dementia, depression, trauma, and chronic pain or pain in general. And I think they're very interrelated with each other. My father had Alzheimer's. He also had a spinal problem, and when I was seeing him suffer, I would see that his memory function would go down as a result of his spinal pain or skeletal pain as well. So that's how this interrelation came about. Because, again, from a free energy standpoint or from a resourcing standpoint, like you mentioned, we need a certain amount of energy in our gas tank to be able to budget certain functions within our nervous system. So I look at the four horsemen as sinkholes, as ways by which certain pathways, certain habituations within the nervous system, as a result of trauma or injury or a degenerative condition, they're basically stealing the free energy from the brain to be able to do what it will. So, Alzheimer's for me is, basically increasing the potholes in the highways of the white matter. And those increasing potholes may be the result of the brain trying to deal with an infection. Maybe it's a mind-gut disorder. There's a lot of theories around that, including infectious etiologies, as you know. But basically, it acts as a thief of the free energy that the brain needs to budget its energy toward more ordered states like creating memory, creating connection. And we depend on the brain as an organ to define us. And that's what makes our work so unique, because we're dealing with an organ system that, has some organ-like things, just like the kidney, clears the bloodstream. The brain has very basic functions of providing sleep and connecting with the gut and connecting with the lymphatics. But it also has these like cool esoteric or psychological functions of defining us. So I feel like when we look at it as an organ, we always have to shift gears between how the psychology and physiology and the structure are very much interrelated. And I'm so happy about collaborations like this because, as you know, in the past, we were all in our little silos of neurosurgery over here and neurology over here and psychiatry over there and psychology over there. And people were like, well, everybody was, I think, and may still go on today in their sort of dogmatic silos. And I think we are an example of a true multidisciplinary collaboration in attempting to address the four horsemen that are going to plague humanity at a very, very high level.
Yeah, it's very interesting. I mean, I look at it in a similar way in the sense that in mental health, when you have these ruminations, going on in your mental space, whether you're fully conscious of it or not. And sometimes you're not conscious of it. It's really playing out at the level of your physiology, your autonomic nervous system, being in these heightened sympathetic states often, or vice versa. But basically, having balance is the key, and being able to break free from those energy sort of vampire loops that we get stuck in, and that's what the psychedelics can do. The sort of rebus model with the relaxed beliefs under psychedelics points to that. And yeah, and the other thing I was going to mention is it's interesting because when you say trauma, I think you mean usually more like a traumatic brain or nervous system injury. Uh,
Indeed.
yeah, but I feel like there's like psychological trauma is also to some degree traumatic to the actual nervous system. That's where the trauma gets stored anyway. So it's interesting. I wonder how you see that relationship.
Fantastic concept to ponder. We have looked for psychological scars in the brain. And now, with the advent of better technology, the connectome map of the brain with sort of like cloud computing and AI and machine learning, we're now understanding what the structural problem of psychological trauma is. Because before, we used to look at, soldiers coming back with severe PTSD and we would image their brain. And if we did not see a contusion in the white matter, we'd say, well, there's no physical basis of this trauma. And that just simply is not true based on our newer understanding of neural networks and the way the brain actually functions. It's much more complicated, but it is structural. So structure is function, function and structure go together. And now we are able to see the psychological scars that you're describing physically based on network connectivity. So based on the strength or lesioning or what happens in the brain as a result of how it can get from one state to the other psychologically with enough metabolic energy is where we will be investigating this hopefully together more and more in redefining the care of trauma in a way that's structurally visible. I mean, it's a very exciting time in neuroscience, and I do believe. I mean, chronic pain is a great example. Many of my patients that have spinal problems have suffered from memory loss, and it's like, okay, again, how did that happen? And they're like, I can't even think straight. I like their life is completely upside down. And it's not as simple as a skeletal pain. It's more of a brain network issue, and it becomes a brain disorder. So I'm really happy you mentioned that because, since my early days in residency, when you're truly like humbled by looking at the brain and spinal fluid and cerebrospinal fluid and actually looking at the physical trauma, you do wonder about everything from, subconscious states or deep depression or things that are underneath the surface of this ocean. And you wonder how you can, do better and better define them. And I think we will do a better job with the new technology that we have. And I think AI is actually going to really help us in that.
Wow. That's really fascinating. Yeah, I mean, I think there's like the two viewpoints of, whether everything is in the brain or are some things just, brain, let's say, being a receptor and, the information is stored elsewhere. I personally think there is some science to it that we have to get to. Ultimately, in either outlook, the brain is that interface that's going to determine, how things roll and how we feel. And, the whole thing is somehow imprinted on there. So I'm excited to hear these developments.
Yeah, I
Uh,
love the way you put that. We have a lot of debates within our advisory board at INI, and we have extremely opposing viewpoints, which I really enjoy because I feel like science only makes progress through investigating those viewpoints, and science is always on trial. So good neuroscience is always going to improve, and the concepts we held so dear to our heart 50 years ago are going to evolve and are either going to be refuted or accepted. So the hard problem of consciousness and free will and many of these scenarios, I believe will never lose their magic as we become more and more and more precise in structural definitions of neural networks. I don't think we're taking something away from the magic of how the brain does this thing by actually saying, no, a lot of it is actually going to be physically understood. And I don't subscribe to the fact that there are unknowable facts. I love the saying that, if the brain was so simple to understand, then we'd be so simple that we could never understand it. So we are complex beings that are capable of so much more than we give each other credit for. I love the athletic analogy of breaking the 4 minute mile, and how after humanity reaches a certain level, it all of a sudden leaps forward, and this kind of collective neurology of humans, I think, is yet untapped. And we could certainly keep going on this, but I don't want to take too much of your time with this, but I look forward to delving deeper in whether the brain, simply gives us conscious access, or is, all conscious phenomenon and an emergent property of our neural networks.
Yeah, fascinating stuff. We had a really good session led by Dr. Thomas Broad, who's on the call, about some of these theories, and we'll definitely expand into it further. It makes me also think, just talking about this connection of the brain to everything else, the functional neurologic disorders. I think that's another very interesting area of the intersection of, where sort of psychology meets actual, the connections within the brain. So I wonder, what's going to come out of that. But one of my colleagues, Dr. Evan Lewis, who's a neurologist, actually treats a lot of these disorders with ketamine. And so there's a role in psychedelics helping with functional neurological disorders. And I think that's another interesting area of overlap.
Incredible. Yeah, I feel like again, trying to be kind of simple and base it on the free energy principle, there's certain brain states that the brain cannot easily achieve unless it has a rewiring amplifier or ability where psychedelic states can provide that. And then all of a sudden, a brain state that was not as easily achievable metabolically becomes achievable. So it's a very huge learning opportunity for the brain when you do have, a psychedelic state with the correct amount of set and setting, and also that the therapeutic approach of the psychological therapy that goes with it, I think is very important, because the brain's vulnerable and open, and so whatever it learns, it can either be of service to it or not. So I think it's a very, very important opportunity for therapy.
Amazing. I mean, I have to say, from my perspective, I have so much respect for you as a neurosurgeon. I remember,
Thank you.
yeah, before applying to medical school, I was doing this sort of shadowing experience, and I went to my first neurosurgical experience, and seeing that brain exposed, it was just really mind blowing for me. And
It's still mind blowing for me.
right,
I
right.
mean, just the spinal cord itself is it's truly awe-inspiring. And every time you see the spinal fluid pulsating and flowing, I do believe that it's like the neurocentric age, and we need sort of all hands on deck. And your expertise and my expertise and many of the neuroscientists, that the giants that have led us here, hopefully we can truly like make a difference and help humanity at a large scale understand itself better. And also the awe-inspiring nature of our nervous system, I think, can be used toward that goal, because I mean, the reason I got into it was truly structural beauty of the nervous system. The brain looks like orchids and ferns, and it literally looks like the most beautiful design you could possibly come up with, which probably has to do with our own concept of beauty, and how we've been, I'd say, encoded to find it so beautiful. So it's never been like about the sort of like the surgical, the cutting part of the surgery. It's always been about restoring beauty and restoring the most awe-inspiring structure in the universe, in the known universe, back to its like original function.
That's beautiful.
Thank you.
I'm wondering if you can talk a little bit about the services that you have been offering through Neurovella and like have you used virtual reality and vibration and things like that? And I know we're going to be using some of that in our collaboration.
Indeed. So there's a lot of applied neuroscience that has some evidence behind it. But just like, acupuncture works on some and not others, just like even certain forms of psychological therapy work on some people, but not everyone. I always wanted Neurovella to be a little bit more menu driven and our clients, not necessarily our patients, our clients, because people can come from all walks of life into Neurovella, can experience entry level therapies like breath work and meditation and self-hypnosis and suggested things to more intense things. And one of the most therapeutic things I found was actually vibration. It works on my body. And I always tell people I use my own physiology as a guinea pig for all of our research approaches in Neurovella. I wear the aura ring. I'm tracking sleep. I myself feel like I'm a better neurosurgeon if I'm able to practice what I preach as far as meditation and breath work. And so vibration therapy you mentioned is one of the most interesting methods I have seen be able to actually induce lucid states and dissolve our extreme adherence to the reality that the brain creates. So if we loosen our grip to the reality that our brain's creating, it provides a window of opportunity for learning, rewiring, openness, and therapeutic sort of curation of what brain states we want and desire. I know you're much more of an expert in that than I am, but I found vibration to be one of those things. And then you mentioned was it zero gravity or sensory deprivation is another one. And then VR, actually, VR has had a lot of work perioperatively. So we actually use it as part of a research protocol for patients undergoing surgery. They get a 30-minute, almost psychedelic like experience with just virtual reality done by our friends at Interstate. And it's a 30-minute journey with brain mapping, with EEG brain mapping that has shown to induce a more relaxed state. So a better sort of theta brainwave to alpha ratio when the clients are undergoing that journey. So that's another one of our offerings. It's more geared toward perioperative, but people come and use sensory deprivation, zero gravity. People come and use vibration as well as VR for therapeutic purposes. There's so many great VR applications right now, and the whole point is to immerse your nervous system in this state of slight loosening of your grip on reality, and then go into that lucid dreaming or less ordered state of the brain, and then use that as a way of recovery.
Very nice. That makes sense. I think that makes sense. Even again, comparing to like psychedelic states, one of the viewpoints on the nature of the psychedelic state is that we're tapping into this mechanism that innately gets activated post-trauma. So, when we're in this post-traumatic state, we require adaptation to new, realities. And so, in a sense, we're tapping into that innate capacity for rapid change, for lowering the defenses and adapting to the new environment. And, all these ways to tap into that could have a role depending on the person seeking that sort of change. And that's what I love about our collaboration is that we can be patient-centered or client-centered and provide the sort of experience they need, which can range from, less invasive interventions like these to, more invasive ones. And so
You
I'm
also mentioned the autonomic nervous system, which I loved, and I didn't emphasize that the initial goal is to simply reset your sympathovagal tone. So the ratio between your sympathetic nervous system and your vagus nerve is easy to manipulate using deep breath work. So that's some of the easiest early entry into the Neurovella option menu of options. So I love the fact that you mentioned the autonomic nervous system because that actually, I feel like it actually gives us much better surgical outcomes when we have an autonomic nervous system that is not off the charts in hypercortisolism and high stress.
exactly. Yeah, that's the goal. With that, I am excited about my friend's offering. So Om Steel, which is the series of guided musical meditation sessions that we've been talking about and we'll be demoing at the clinic next week. I'm excited to have tools like that in our toolbox, and I know you have some that you already use as well. But using whatever method we can to provide the safest, most appropriate care, I think is the mutual goal of both of our practices.
I truly look forward to it. I'm so excited. And it is a little bit of a, trial and error for every one of us. Just like when we, try on a shoe or do an athletic exercise, I feel like cognitive fitness is going to be another aspect that we all need to deal with on a daily basis instead of, only looking at it as oh, I have this problem, I have to go to a psychologist. I want Neurovella to be an everyday practice where people engage their mind and connect to that primary consciousness and balance their sympathovagal tone and get better sleep and have better relationships and have better response to trauma. I feel like we all absolutely need it. So I can't wait to continue to delve deep and curate our menu options even better and have science behind it.
Yes, I'm really looking forward to the research opportunities ahead of us. There are so many cool things we could study, and props to you for setting up the INI and having that ability to start doing trials and see what works for who. I also know that you've launched a supplement recently, Axon, I believe it's called. So I'm wondering what you think of supplements in general, and if you could tell us a bit more about your own supplement.
Sure. Thank you. Thank you for that. So, for years, I attended uh, nutritional style conferences about nutraceuticals because there are many conditions that our patients have that are not easily treatable. One of them being like neuropathic pain post-surgery. And I wanted to find an array of supplements that are safe to take that can never be like you can never overdose on per se, that also have great therapeutic effects for the nervous system. So having seen my father like have side effects to these powerful Alzheimer's drugs that didn't really help him was sort of like the initial impetus. We came up with 9 key ingredients that are both adaptogens and vitamins, things like acetylcholine, bacopa, lion's mane, B6 and B12 in the methylated forms, and came up with this supplement called Axon, which is now on market. And we're able to actually do some very low level safety studies on it, which show that you can never really overdose on it. And they act like as adaptogens and as a regular multivitamin for the brain, creating membrane stability, improving clarity and focus, and certainly nutraceuticals per se, depending on the kind of gut you have and the kind of absorptive capacity you have, bioavailability of these nutrients can be very different. So I am the first one to say I would like this studied further to see if it works on everybody because just like the Neurovella offerings, it's going to work as a bell-shaped curve on a lot of people better than others. And I do think that the gut health and our microbiome, as we understand it better, will give us a lot better information as to what specific supplements we need personally to improve our nervous system, our lymphatics, our mind-gut connection. But I appreciate you bringing that up. Another thing I use in Neurovella, I always say we can deliver three things to the nervous system. We can change its wiring or its brain state or whatever. We can give it electricity or take away electricity. We can give it chemistry or take away chemistry, or we can give it a learning opportunity or deprive it of our learning through sensory deprivation. So, electricity is things like TMS. Chemistry is things like Axon or tonics or oils. You can also take that away by fasting, simply seeing what happens when you deprive the system of something. And then lastly, the learning opportunity is what you just said with, things like psychedelics, assisted therapy. The brain is literally open to learn, and it learns through an integrative therapeutic approach, or through the other end, like sensory deprivation, where the mind is left to open on its own and become like an empty library in which you can piecemeal what you want, what kind of books you want in there. So yeah, thanks for bringing that up. I do think, nutrition is a huge part of what we do on a daily basis to our nervous system. I like to tell my patients we are all neuroscientists on a daily basis because every morning you are figuring out where your brain energy is, and do you need coffee or do you need a juice or do you want to fast till noon and see how your body actually recaptures its energy through that fasting experience. So I feel like we're constantly doing energy management with our nervous system. I mean, that's why, Red Bull's so popular because everybody in the Western culture, we all want that extra uptick. But I'd like to bring things to our clients and our patients that are actually not necessarily harmful to their nervous system and and things that are actually therapeutic and helping in the long run. And I love the work of some of our board members. Dr. Emmerin Mayer, at one of the board members, I has done seminal work for polyphenols and um, how the gut microbiome literally can monitor and even set our moods and set the way our nervous system is actually functioning. So we're all neuroscientists. Don't forget.
That's great. No, I really like that. I think for sure every single one of us has that part in us. And sometimes we're aware and sometimes we're not. But yeah, you brought up Dr. Emran Mayer, and I met him through you and pretty fascinated by all the work he's done. Um, we do some research on pain, actually. We have a study where we're giving CBD for patients with chemotherapy-induced peripheral neuropathy and comparing the effect of CBD at higher doses, and exercise or multimodal exercise program, and we're studying the gut omics sort of picture and starting to see some interesting patterns. This is what you're saying in terms of the microorganisms that live within us have a significant impact on every sense of our response to the world. And it's really fascinating.
Fascinating.
Yeah. And so that's another tool that I hope we'll be offering is the Enjoy product, which I'm a co-founder of, but it's basically using AI to analyze our daily habits and our microbiome to give us personalized recommendations on gut health and beyond. It's fascinating the amount of research coming out on the microbiome. And so we've actually built this engine that now automatically finds new papers, tests their rigor, and incorporates it into the algorithm. And so I think that sort of complex processing will be required for such a complex environment like the microbiome.
I love that. We've talked about that at I&I a lot. And, when you hear major scientific papers being retracted because of bad data or bad science, like what happened with the beta amyloid papers that have been cited over 250,000 times as evidence of the beta amyloid hypothesis in Alzheimer's, I think you realize how difficult it is for to actually get good science done and to make something stick and provable and reproducible. And a lot of science actually happens by happenstance and luck, and we've seen that historically. But now we have tools like you just mentioned, where we're gonna actually figure out how the human body works. And it's awe-inspiring to look at the intersections of all these microorganisms with our own cells, with how the liver and kidney and the muscle are so important in the way we store certain metabolites. And I mean, I'm fascinated by it. I'm also really inspired by how better of a physician I will be with that additional information and integrating that into our, say, spine surgical approach. I have many patients that have hormonal imbalances, bad bone quality, bad muscle conditioning, and they're asking for surgery. And, to optimize their outcome, I could just do a structural surgery and say, okay, the x-rays look great, thank you. And but that will not bring them the optimal outcome unless I get someone like you and an endocrinologist or someone else to actually deal with their nervous system, their musculoskeletal system, their endocrine system in an integrative fashion. And I think that's the sort of collaborative model we are setting here in treating the whole person at every level and understanding the complex systems that govern the body and recovery and healing.
Amazing. Yeah, I mean, if I had a neurosurgical need, you'd be my top choice.
Thank you. I look
For
forward to your
sure.
service as well.
Cheers, of course. Yeah, I mean, this concept of mystic health as it was developed, it really goes along with what you're saying. And the idea is, there's this core component of health that applies to everyone. You don't have to be diagnosed with a serious illness or be at the end of life, but it's this outlook towards life. And I'm really happy that you sent me that link a few nights ago because this notion of the brain-heart connection, I think, is very important. As some may know, the heart has its own nervous system, just like the gut and the brain. So we have these like three nervous systems interacting. And there's some new research coming out, showing about the importance of the heart brain connection. In addition to the gut brain connection, the heart brain connection is a very important factor in experiencing perhaps the mystical states or having breakthrough type psychedelic or altered state experiences. And so that is another area where I would love for us to sort of explore further. If we're in mystic health, we should be able to tap into our heart, rather than being stuck in our minds.
I love that. I love that we put that. My version of saying that has always been that there's not just a nervous system, there's the grander nervous system. So at INI's advisory board, we have like Dr. Claudia, who is an expert. She's a TED speaker on skin and brain connections, and her work is absolutely fascinating. Dr. Mayer is mind gut connection. We don't have a heart connection yet. Maybe you can be that or connect us with a cardiologist that thinks that way because the heart's the most magnificent electromagnetic generator in our body. So just the amount of energy it creates and the type of magnetic dipoles it creates, it literally charges our body. And um, I love the fact that you even brought the mystical aspects into it. I have no doubt that our grander nervous system connects in ways that have yet to be discovered to a lot of phenomena that we experience, and we may call it energies or vibes or whatever you want to call it. I have no doubt that these are physical phenomena that we will figure out with better research and better science.
Yeah. Yeah, I think what's nice is that we can acknowledge that we don't ultimately know what the truth is, with our reality, with our consciousness. But what's clear, at least the message that the mystic health is giving, is that, we are not pure egos. The ego as this generated construct by the nervous system to help us survive in this, highly dangerous environment where we evolved, plays an important role. But there's a balance. Too much ego is sort of an illusion, and then, too little ego also is really not fit for functioning. So I always say, perhaps when someone is entering the final stages of life, the shift towards mysticism could be moving in that direction of ego dissolution, of feeling one with the universe, of experiencing timelessness. And this is what we see, especially when treating patients at the end of life in psychedelic states. These are the experiences that provide benefit. But perhaps as someone who's in their prime functional state, you don't want to be full of ego dissolution. You want to have the ego, but you want to be in that flow state where the ego is sort of tapped in and congruent. That's the term we use a lot in this mindful medical practice course, is congruence. And the idea is that you have awareness of yourself, of the other, of the context, and you're responding in a mindful way, such that you have a mindful pause after a given stimulus, rather than getting triggered into some reactions that are usually based on childhood type traumas.
I love the way you put that, and I would say that's a very good way of summarizing what I was trying to mention with the two rooms of Neurovala, or the free energy principle, where you have to oscillate between these two states, and congruence of the ego to make you experience more flow states throughout your life, or have a successful or better coping mechanisms in and around the unavoidable suffering and the trauma of life is our goal. And that was really well put.
Thank you very much. Um, yeah, I wonder if you have any personal stories you can share in terms of your experience doing the neurosurgery for all these years, and perhaps how interventions like what we've talked about has resulted in a different type of response. We would love to get an example.
Absolutely. The extreme cases are things where something like discogenic back pain or neck pain have caused such level of psychological disarray that people have literally lost memory and their relationships and their. I had a gentleman that had not left his house for 6 months due to the severity of the pain, and he was just, as you can imagine, very deconditioned, and physiological disarray, psychological disarray, and we had to perform a surgery on him. But post-surgically, we connected him with a pain psychiatrist that was able to not only give appropriate post-operative pain medications, but also like talk to him and actually engage his nervous system at a much deeper level. We also checked, his hormones, his labs, his thyroid function, his endocrine panel, and we were able to get him really high functioning. He was an investment banker. He was so thankful that he made a donation to our nonprofit research organization, and we were able to offer, free surgeries to some of the homeless during the pandemic. So it really stuck in my mind that we had these resources because of the good deed that we did by helping one guy. It felt like Robin Hood, where we were taking from him and giving it to the poor. But it really stuck in my head about the simplicity of what I do with precision work in spine surgery. Ultimately, I'm just meticulously changing the anatomy for the better. I'm decompressing spinal cord and nerves, and I'm putting, artificial disc implant or something like that, and making sure the spine is at its optimal kinematics, both from a postural standpoint, et cetera. And we could, certainly delve deeper into that. But physiologically, what happens to brain and the patient's brain health as a result of spinal restoration, and maybe we can tie it to CSF pathways. Maybe we can tie it to the nerves that are decompressed have extra energy. It's fascinating. So that was one of the cases that really stuck in my head. The second one is from when I was a much younger surgeon, is when a very nice patient that had a really simple surgery, had great benefit from the surgery, and then all of a sudden his pain returned. And when I spoke with him, he was undergoing a divorce. And the stress from this psychological disarray of divorce had literally brought his sciatica back. And I had to wonder, like, what exactly was happening in the sciatic nerve, where without any anatomical interruption, all of a sudden it was not getting enough juice in the body budgeting of the nervous system through what happens in the brain spine or mind body connection. So, people always say that. We use that routinely. Oh, it's just stress. It's just stress. But, I think physiologic stress happens at the sort of like the lymphatic system or at the cellular level in a way that I look forward to understanding better and more precisely. And I think that's great segue to like the things that you're working on with the gut microbiome. So what happens when we experience psychological stress and it translates to physiology? Are we creating cancer cells? Are we more susceptible to infections? Are we creating sciatica or getting recurrent sciatica? So these are states that I really would love to research more and find out what exactly happens physiologically. So thanks for bringing that up.
No, thank you. Honestly, it's great to hear, these words coming from a surgeon. One of my mentors, Gabor Mate, I bring him up because he's really influenced my path in medicine. And he has this book, When the Body Says No. And there are a lot of theories like that out there. But this idea that our psychological state, if we were to summarize it, can result in pathology at a physiologic level. And so doing research to find out, where that intersection is, that is what's most fascinating, I think.
Yeah, I love his work on trauma. He's definitely one of the biggest influencers in our understanding of that. So
Amazing. Yeah, I think we're almost out of time for today. I'm wondering if you have any last thoughts you want to share.
yeah, the first thing I'd say is that I really am honored to be part of this. And again, I look at it as a learning experience. I think evolution of a surgeon happens kind of logarithmically in the first 5 years when you're, trying to figure out your craft. But, after 20 years out, I'm at a sort of a nice steady state of, my surgical skills. So I want to become a better physician by understanding these other aspects of the nervous system and creating integrative neurosurgical practice so I can be more accurate in my outcomes and more successful in optimizing my patients. So I appreciate opportunities like this and collaborations like this a lot. I'm also available for questions and discussions. As you and I, send each other random neuroscientific articles all the time, and I want to invite our audience to subscribe to that method and engage with us at Mystic Health, at neurovella.com. Our surgical practice is a neurosurgical spine group. So for those who have questions about their spine or any anatomical things that they have questions about, pain especially, um, we're at nsg-la.com. You can also find me at drvokshoor.com, drvokshoor.com, for any questions or concerns. And I really look forward to furthering this, deepening this, and hopefully our audience next time will have sent us a set of questions that we can actually address specifically. Because I think we're also on the precipice
Precipice.
of amazingness in discovery of the nervous system.
Thank you. I really can't wait to work together. And I'm very thankful for my cousin Daphne, who's on the call, who
Oh,
thought of
Daphne's
connecting.
on the call. Hi, Daphne. I think if we've ever met, I've heard so much about Daphne.
Amazing. Amazing. So thank you to everyone who's joined us, and this will be on our YouTube channel at mystic.healthy and Dr. Vokshoor to many more of these in the near future.
Thank you so much. Look
Thank you.
forward to more.
Take care.
Thank you, guys.
Bye, everyone. Cheers.
Take care.